Hello and welcome students to Career Chat. I'm Joan Dixon, the Director of Student Programs at Gulf Coast South Area Health Education Center, and Career Chat is just one of our many student programs that we can offer to you. Career Chats is all about interviewing healthcare professionals, recording them and putting those recordings on our website so you can watch these career videos any chance you get to help you explore all your future options to become a healthcare professional. I am happy to introduce to you today Liliana Irwin, who is a certified medical interpreter. Liliana Irwin is a Spanish interpreter, translator, and cross-cultural trainer with more than 20 years of experience in the field. She has a bachelor's degree in Spanish from Augusta State University and a graduate certificate in translation from Georgia State University. Liliana is also a nationally certified medical interpreter, a state certified court interpreter, a licensed professional community medical interpreter trainer, and a Command Spanish licensed occupational Spanish instructor. Phew. And I'm also pleased to say that she is one of my colleagues at Gulf Coast South AHEC. She is the Access Program Director. So Liliana, tell us what you do at GSAHEC as the Access Program Director.
Thank you, Joan. That was a great introduction, and it sounds so pretty when you say it. So thank you so much. So yes, I have the pleasure of working with Joan as a co-worker at Gulf Coast South AHEC. I am the Access Program Director. Access stands for Advanced Cultural Competence Education and Support Services. I know it's a big mouthful of words, but that's what we do. We try to educate the community. We try to educate providers, and we try to support people who want to get into the medical field as medical interpreters. We educate providers by letting them know about the importance of using medical interpreters, professional medical interpreters, trained and qualified medical interpreters to avoid risks, mostly malpractice risks in their places. We educate the community about the importance of using or asking for, requesting professional interpreters when they go visit their doctors, just because it is important that they understand completely what they are being told at the doctor's offices so that they can make informed decisions. And we support our community by educating bilingual people that are interested in working in the medical field or that are already working in the medical field, in getting trained as professional interpreters. To be an interpreter is not only necessary to speak another language, but to know the ethics, standards of practice, and all the codes that we need to abide when working as medical interpreters. We also support our non-bilingual providers by teaching occupational Spanish classes for them, and this is also part of the program. And the other part of the program is that we also teach cultural competency seminars and classes so that we can teach our providers how to work effectively with diverse communities.
Wonderful.
We do all that.
All very important programs. And if the students were thinking, well, you know, interpreters, how important is it? Extremely important, because can you imagine? Well, first think of all the different languages that are spoken throughout the United States. And then think about if you have limited English proficiency, you can maybe only understand a little English or maybe no English, and you get sick and you have to go to the hospital. How can you understand the doctors and nurses? How can they understand you? That can lead to mistakes being made or misdiagnosis or treatments not being proper for that particular disease or illness. So interpreting, very important, and we are going to delve into that during this interview. But first thing, we want to show you a funny video from I Love Lucy. that gives you an idea of how important that interpreter can actually be. So bear with me just a minute. I'm going to bring that video up. And Liliana, I'm going to look to you for a thumbs up to help me make sure that the sound actually comes on. So here's the video.
Oh dear, they're going to send me to jail,
Non,
aren't they?
monsieur, parlez-vous français?
They want to know if you speak French.
No, I know. No parlo francés. Yo hablo español.
Oh, espagnol. Espagnol. Allez me chercher le poivron.
Oh, tout de suite.
Excellent idée, vous venez tout à l'heure. Bien, très bien.
What are they talking about?
How would I know?
Oh dear, they're going to send me to the guillotine.
Now, you just take your time, honey.
Non, voici mon idée. Je vous parlerai, vous lui parlerez, il lui parlera et lui il parlera à la dame. Allons-y.
Spricht zu mir, ich spreche zu Ihnen, Sie sprechen zu ihm und spricht zu ihr.
Él le va a hablar a él me va a hablar a mí. Yo le voy a hablar a usted y usted le habla a la señora.
Ah, muy buena idea,
What?
Very good idea.
What is?
Oh, the sergeant only speaks French. See, and now this other cop here, he speaks French and German. And this fellow, he speaks German and Spanish.
Oh.
So he's going to ask the questions and we'll translate them to you.
Oh, good.
Bueno.
Cierto. Bon. Et où puis cet argent?
Wo haben Sie das Geld her?
¿Dónde toma ese dinero?
When you get the money.
I got it from a man on the street, but I didn't know it was counterfeit.
Me lo dio un hombre en la calle, pero yo no sabía que era falso.
Eine Menge de Straße gebe ich zu mir, weil ich denn nicht, was ist das Geld?
Je l'ai reçu d'un homme dans la rue et je n'ai pas su que c'est faux.
Ha! Ha! Ha!
Ha!
That cracks me up every time I see.
I love it.
I love that video. So that just gives the students an idea of how very important it can be to have translators in there to understand each other.
That's
What
right.
I would like to put up now is, if you hear the term interpreter and translator, what is the actual difference between interpreter and translator? So I'm going to put that information up on the screen here. All right, what is the difference between an interpreter and a translator? Interpreters assist in oral communication. Translators convert written material from one language to the other. None of the above, all of the above. What is the answer to that, Liliana?
A very good question, Joan. And I think there is a very wide misunderstanding. People think that these are either the same thing, or one thing that I have heard is that people think that translators do things very accurately and literal, and interpreters kind of like give their own rendition of what they think the other person is saying. So neither one of those are true. The actual difference is very easy. Interpreters assist in oral communication. Everything that is oral is done by interpreters. Now, if it's written, it's done by a translator. So that's the main and only difference.
Wonderful. Thank you for clearing that up. It's important for the students to understand the difference between those.
Mm-hmm.
So I'm getting ready to launch into another quick video about the actual role of the medical interpreter. Hold on just one second. And I'm going to look for a thumbs up.
Please speak one at a time so the interpreter can interpret.
Interpreting is the act of orally transmitting a message from one language to another, online and in real time. The interpreter's task is to listen to the message, comprehend the message, abstract the message from the words, end the word order, store the ideas, search for the conceptual and semantic matches, reconstruct the message in the other language, while listening for the next piece of information, and managing communication. Translating is the act of transmitting a message from one language to another in writing or via scripted video. It is done with sufficient time for consultation with other translators, dictionaries, texts, and researching common usage. A trained interpreter has superior language skills in both languages, specialized medical domain terminology, highly developed memory skills, and the ability to manage the communication lines so that the patient and provider are speaking directly to each other.
So the students may be wondering at this point, well, okay, what's the big deal? That sounds easy, right? You're just listening to somebody and repeating what they said. I mean, what's the big deal? Now let me show a video about just how easy it really is to step into the role as an interpreter. Hold on just one second.
I like this video.
Okay, I would like you to take 2 of these pills 1 time a day before eating and for 10 days.
I'd like you to take 2 of these pills before eating for 10 days. Sorry, I'm frazzled.
I would like to take this pill 4 times a day. After the rest I lost, I'm sorry.
I'd like you to take these 2 pills twice a day before eating and take this 1 pill 10 times a day.
I'd like you to take 2 of these pills before eating and 1 of these pills, I don't know, once a day? Once a day.
I'd like you to take 2 of these pills 4 times a day and this other pill, take it once every 10 days.
Okay, I'd like you to take this pill 2 times a day for 4 days before eating.
I'd like you to take these 2 pills 4 times a day, 1 once a day for 10 days.
In addition, professional...
Oh my goodness, Liliana, not a single one of them, except for the trained interpreter,
That's right.
got it right. I mean, can you imagine? One of them said, I would like you to take this 1 pill 10 times a day.
That's right.
Oh my goodness, you can't do that. You could kill people that way.
That's right. That's why it is so important to have trained and qualified interpreters helping us.
Absolutely. So when we're talking about the benefits of trained and qualified medical interpreters, I have a list of just a few of the benefits here. I'm going to put those on the screen. Benefits of medical interpreters. They improve communication, patient satisfaction, and family engagement. They reduce the liability risk. They fulfill Joint Commission and class standards recommendations. They increase patient utilization of preventative services, follow-up care, and adherence to treatment. All of the above, and probably some of them that I am forgetting. Liliana, as we've mentioned, the benefits are astronomical for medical interpreters. Is this something new on the scene? How long have medical interpreters been around?
Well, that's a very good question. So the skill has been around forever. We have even books that show histories of interpreters being used for trading back when, Egypt and Mesopotamia were trading together. So when the big empires were trading stuff, they used interpreters to communicate. We have even stories in the Bible that show the use of interpreters. So the skill has been around for a long time. However, really the use of trained and professional interpreters started being a little bit more professionalized when we had the Second World War. and they had to do the Nuremberg trials. They started using legal interpreters to interpret. After that, when we started having the big influx of immigrants to different places of Europe and the United States, the government started realizing that it was more expensive to see people that could not communicate in the language because they would not know how to treat themselves at home. They would come to see providers, they would go to hospitals, and the hospitals would give them a treatment plan, but they would not follow it at home because they didn't understand how to do it. So they started realizing that it was important to have this type of language access for people that could not understand the language very well, even if they spoke some. So we call these type of patients limited English proficient patients, or LEPs. So those are the patients that maybe speak the language a little bit, but they are not fluent enough to communicate or to understand everything that is being explained to them. So those are our LEP patients, and those are the ones that we really focus on. So the short answer to your question is it's been around for a while. It has been professionalized not too long ago, probably the 70s or 80s. It started becoming more prominent in the United States. And during 2008, the pilot to develop national certification was created. 2010 was the first time when interpreters actually started taking tests to becoming nationally certified and have in that manner something that proves that they have taken the steps to know what they are doing.
I can imagine the push to get interpreters into hospitals, clinics, and any place that provides healthcare for limited English proficient patients. That priority really came about when all those malpractice lawsuits started rolling in, and people getting sick because of what they thought was the treatment because they didn't understand. And they can have very deadly outcomes, unfortunately. So let's get into your career, Liliana. We're going to ask you some questions about how you got from high school all the way up to your career as a certified medical interpreter. When you are working in your career as a medical interpreter, what fellow health professionals might you work with?
So I have had the fortune, and I think that this goes to many of my colleagues and most of the medical interpreters that I have known through my career. I have worked with pretty much all of them. So I had a job as a hospital, as a staff interpreter, and I had to go everywhere in the hospital. So I would start, let's say, in the emergency room, and then they would call me from OBGYN because somebody was in labor. So I had to go over there and help. Then maybe later on, they called me to radiology because somebody was in for some for an MRI or x-rays or whatever, and they could not speak the language. So I would go down there. I have even attended surgeries. And, you know, they need me in there, of course, until the patient is sleeping, or like in some cases, deliveries that require C-sections and they are awake. I don't know how many C-sections I have witnessed, cardiology, pediatrics, oncology, speech therapy, I mean, you name it. So I have been fortunate enough to work with every single type of provider. However, I do also have colleagues that work in specialized fields. So let's say there is a big organization that provides orthopedic services. They work for them. They have several offices. I have colleagues that go from office to office within the same practice, and they help them with their, well, the ones that I know are Spanish speakers, but I know that there are several, especially here in Florida, several languages that are very sought after. One of them being Haitian Creole, Vietnamese, Russian. So it's not just Spanish. I just happen to know it because that's my second language. But yes, yeah. I have had the fortune to work with most of them.
Thank you for bringing that up, because we're not just talking about the Spanish language, we're talking about all languages need interpreters. And it sounds fascinating how you could either stay with a certain practice, a certain discipline or modality, but that you could also then choose to go from a hospital from discipline to discipline. Talk about having options and keeping things interesting. This is a fascinating career that I think not too many students know about. And not only could they have it as a full-time career, but they could also choose to do it as, like a contractor work on the side.
Exactly. So I have had multiple students taking the class to be trained as professional medical interpreters who already worked in the field, and they already are being asked to interpret. So they just want to do it correctly, and their practices want them to do it correctly, again, to avoid liability issues and to prevent risk and to really work with the patients. But I think it's just a win-win situation. The patient wins, the practice wins, the interpreter is a big win. So they come and take the class to enhance their resume, to make themselves more marketable, and to have an upper hand when a promotion comes up. So if you come into a doctor's office or if you start your career at a practice, at a medical practice, and you are already bilingual, and you add to this the fact that you have been trained as a medical interpreter, that really sets you apart. So you are completely right. Some people work in whatever work they do during the day, and they tell me, Liliana, I get out at 4, and then by 6 or 7 p.m. I don't have anything to do. There are actually agencies that look for interpreters to work 24/7, because if COVID, one of the many things COVID has taught us is to use technology. And when in Florida is 6 p.m., in California may be 2 p.m. So they still need interpreters to do telehealth or video remote interpreting. So, and there are several, the technology has opened so many doors that you can work with agencies for 2 hours a day. You can work with them for 6 hours a day. So as you said, this could be a full-time job, it could be a part-time job, or it could be as flexible as you need it to be.
I think it's wonderful to have the options of not only being an in-person interpreter, but also doing your interpretations over the video like Zoom or Skype or Microsoft Teams, or doing phone interpreting.
Exactly. So those are terms that we use regularly in this field. Is VRI, which stands for Video Remote Interpreting, or OPI, Over the Phone Interpreting. So you can do exactly. It's very flexible. You can do both. You can do one, or you can be an in-person interpreter. There are hospitals that do hire people to work full-time as interpreters. So those are in-person. And so that's another option.
Wonderful. Now we've talked about how you have worked with all different types of health professionals. What kind of patients do you work with as an interpreter?
So again, you work with multiple different patients. I have had people that just need the interpretation because they are not fluent in the language, but they are doctors in their own country. So they don't need any type of explanation. And that's something that I would like to maybe touch quickly. When you are an interpreter, you don't have to explain things. You just need to be so fluent. Your vocabulary has to be so rich that you can find equivalencies, but you don't have to explain things. That is up to the doctor. That's what we need, culturally competent doctors that know what questions to ask. Some patients may need a lot of explanation from the provider, and some other ones may just understand everything. So we work with every kind of patients, from very, very educated patients that have come from their countries for different reasons, to people that have come here to work hard, to work in the fields, and they just come to see the doctor just as anybody else could come with their families, by themselves, and for any kind of reasons that any person that speaks the language will go to see a doctor.
And I thank you for clarifying that, because there could be some students out there saying, well, how could I be a medical interpreter in the healthcare field when I've never studied anything in the healthcare field? But as long as they are fluently bilingual, they are going to be trained by someone such as yourself, a nationally certified medical interpreter trainer, to learn about the different scenarios, to learn about the interpretation methodologies.
Exactly. And a lot of people ask me, Liliana, I don't know any medical terminology. And that is okay. That's why we study. That's what we educate ourselves. So if you already have the bilingual skills that you need, then maybe your focus should be a little bit more on the medical terminology part of it. But I have some other patients that come and say, medical terminology does not scare me because I have already been trained as a CNA or as a nurse assistant or, whatever field you're in. If it's in the medical field, that will help you. That will give you basis. What you need to do is to feel comfortable speaking both languages and to be fluent. And if you are a little bit hesitant, if you say, well, I have been speaking Spanish with my family my whole life, but I don't know if I have enough skills, there are some tests. They are language proficiency tests that you can take. And that will tell you if you have the skills to be a medical interpreter. And if you don't, then that just means that you need to focus a little bit more in increasing your vocabulary and in maybe your medical terminology, and that will set you to be successful in this career. So don't be afraid if you feel that you are not completely ready because you don't know if your second language is good enough. You can always sharpen those skills just like anybody else. You just dedicate yourself to study some and to practice some, and that's all you need.
Absolutely. Good advice. And you've already touched on the fact that there may be no such thing as a typical day because you could be going from hospital to hospital or clinic to hospital, and there's really no such thing as a typical work week. You could either have a set 40-hour schedule or just take on jobs as you need it. So the options and the flexibility are fantastic. What type of a starting salary can a person expect to make in this field?
That is a good question too. So it all depends on how you work. If you work as a contractor, well, most likely you will set up your own rates. And in order to stay competitive, if you have no experience, the rates probably start somewhere between $20 and $25, somewhere around there. If you
per hour?
Per hour, yes. So it starts right there. There are some. So now we have to think about the demand that you have for your language. If you speak a language that is very exotic, that may go up to $45, $50, $60 an hour. If it is a language that has a lot of other people that offers that same language, it may be a little bit lower. One other thing that has happened because of technology is that maybe agencies have a bigger pool of people to choose from. Because if they are interpreting via a video remote interpreting, they can find somebody in Colorado who can interpret in Florida. So that gives them a bigger pool of interpreters. However, if you have the education and the national certification, that gets you started at a good rate. And if you want to work from home, let's say that you want to work as a video remote interpreter or as an over-the-phone interpreter, then you're not going to have to leave your house. So you are not going to have to incur into expenses that people that may work at a facility or at a certain practice would have to incur. You can eat at home. You don't have to spend gas. You don't have to spend time getting over there. So those are things that you also need to consider when reaching out to agencies. But I would say somebody without experience or much experience, you need that. This is something else that you need to do. You need to try to find as much experience, where it is a volunteer job, where it is shadowing hours, just so that you can put it on your resume. But if you have experience and if you do have education, you can get up to $45, $50 an hour. One thing that I want you guys to understand is that it is a standard on this field to charge for at least 2 hours. So whether you work or you interpret for 15 minutes or for 2 hours, you will still, as a standard, get paid for 2 hours. So the more experience you have, the more education you have. If you are nationally certified, you're gold, because there are not many of those around, especially in the state of Florida. So education experience, just like in any other job, will get your rates higher. But short answer, it could start somewhere probably low 20s to mid 20s, somewhere like that.
And that's good advice, as you mentioned, in any career field. Students need to be aware that they need to make themselves the most marketable they can, because you can't be naive enough to think, okay, I've gone to school, I've been certified, look out world, here I come. Well, so are other people out there all vying for the same job. What's going to make you stand out? Well, it's not just being an interpreter, it's being a nationally certified interpreter. That's what's going to get you the call back. So that's good advice.
Yeah, and a lot of people, Joan, that I have met and that have taken my class are people that are already enrolled somehow in the medical field. For example, they start working as, let's say, a receptionist at a medical practice. And because they speak the second language, they call them here and there. Oh, hey, can you please help us here with this patient who does not speak English? So they have been acting as interpreters, whether or not it is in their job description. They have been acting as interpreters, and that's what we call ad hoc interpreters. So they do have that experience. So they can add that experience to their resume. And once they get the education, they have the experience and the education. So they can choose whether to stay with the practice and grow with the practice, knowing that they are already trained and qualified to do this, or they can just try, and if they like it enough, to work as medical interpreters as their careers. So
that's a wonderful way to boost your salary. If you're already a healthcare professional in any of the disciplines, then go ahead and get certified as a medical interpreter on the side, boost your resume, get more money. So basically what it comes down to is, if you are fluently bilingual, it would not hurt you at all to go ahead and get this certification. It's only going to increase your viability as an employee and get you some more money.
Exactly. And we have to also clarify something. So when we talk about trained and qualified interpreters, we are talking about people that only take a 40-hour class. So this 40 hours class will get you a certificate and will prove that you have been trained and you know how to act professionally and how to abide by the ethical principles of the profession. So that is a certificate. Now, when we talk about a certified interpreter, that means that after getting that training, you go through a process of certification. Now, that process is a little bit longer and it is a little bit more strenuous. You have to apply, then you have to take a written test, and then you have take and pass, of course, a written test, and then you have to take and pass an oral test, which just grades your skills as an interpreter. So that is a process that usually takes several months. But in order to present a certificate that proves that you have been trained, it's only 40 hours. I believe that this is a great investment in any career and for any person who speaks a second language. From there on, if you want to go forward and go for the gold medal, then go through the process of certification. That's what makes you nationally certified. So there is a difference between having a certificate of education of training and being certified, nationally certified. There are two different things, and it's important to understand that part.
So again, students that are listening out there, you don't have to go to school for a year-long program, a 2-year program, an 8-year program. You can do the learning portion of medical interpreting in 40 hours. It's a 5-day class. Exactly. It's a 5-day class, and then go on to study for the national exam. Where else can you find a career that gives you flexibility and great money in just a 5-day class? This is a wonderful option that a lot of students just don't understand is available to them.
Right, exactly.
So Liliana, why did you decide to pursue this career? How did you fall into it?
That's a great question too. So it kind of fell on my lap, really. I started working in an insurance company back 1,000 years ago in Atlanta, Georgia. And through the insurance company, I was called to help case managers talk to. So this was an insurance company that focused on workers' compensation injuries. So the case managers that were following these injured workers used to call me because they could not communicate with the workers and make sure that they follow the treatment. Now, you know that when a person gets hurt at work, if they get pulled out of work, they don't get back until they get better. So the case managers wanted them to get better quickly so that they could go back to their jobs, and that way the companies don't have to keep paying them for being out of work. So they would call me and they say, hey, would you mind talking to this patient, just making sure that he's following the treatment, making sure that he's doing things at work that at home that he's supposed to be doing. So I was like, yes, of course. After that, they started asking me to go with them to the appointments. And back then, this was good, probably 25 years ago when I was 5. And that was a joke. Okay, so this was probably about 25 years ago, and there were no regulations. So as long as you spoke the other language, you could go and do it. Things have changed a little bit. So providers are a little bit more careful now to use trained and qualified interpreters just because they want to reduce liability risks. But back then, I would go with the case manager and the patient to the doctor's office, and I would interpret for them. And so it started very informally. After that, I found out that there was a class where I could learn how to be a translator. Remember the difference in interpreters and translators. So I registered for it because I figured it would be a good addition to what I was doing. But back then, there was not really any type of formal training for interpreters. After working with them for several years, so I completed, it was a 2-year graduate program, and I completed it, and it was in translation. But I kept working as an interpreter. After that, they started calling me from other case managers and other case managing companies, and things just started kind of falling on my lap, thank goodness. So I started working like that until I moved to Augusta, Georgia. And from there, I was contacted by a hospital that actually hired interpreters to work directly with them. We were contract interpreters, but I was a contract interpreter, but I was covered under the umbrella of the hospital. So I was pretty much on call 24/7, but they called me and allowed me time to get to the hospital to see the patients. And some days they needed me all day, and they told me, can you be here all day? So I was able to just kind of flex my time with my family and work. So it was pretty convenient. And that's where I really started my career as a medical interpreter. And after that, I started training medical interpreters for them because, and this is another thing that, guys, you need to understand. A lot of employers, if you work with a medical practice, they pay for a lot of them. I'm not saying all of them, and you would have to talk to them and just advocate for yourself. But a lot of them pay for their employees to have this training because it's a benefit for them as well. So this hospital paid me to become a trainer so that I could train other bilingual employees and other people that wanted to work as interpreters. And that's how I got my license to teach how to become a medical interpreter. And then after that, I was called to participate in one of the pilot programs for national certification. So I participated there, and then later on, I got nationally certified by taking the whole process, as I mentioned earlier. And that's it. That then things started rolling, and then I just
and now you're the Access Program Director at Gulf Coast
Exactly.
South AHEC, paying it forward by teaching future medical interpreters. And that's a wonderful career path, education path and career path that you have followed, because that also shows the students that you never stop learning.
Exactly. And you never know, you have that skill, guys. If you guys if you guys are interested in being a medical interpreter, most likely you already have that skill of speaking that second language. I have had them, but I rarely have a person that says, hey, I'm so interested in Spanish or in another language, and I'm learning and I want to be fluent. And after that, I want to become a medical interpreter. And I love that. I applaud that, because that is twice as much work that they have to do. But if you are already bilingual, if you already speak the other language, you are halfway there. So it does not take too long. Is, as you said, it's just an investment of, at the beginning, 40 hours. And then after that, you already have something to write on your resume. So if you want to get a job at an office, a doctor's office, a medical practice, even in a hospital, and you already have this on your resume, I think that will set you completely apart from everybody else that is applying, even other bilingual people.
Absolutely. Now, because we want to be real with the students, always, we need to discuss, the good, the bad, and the ugly. So what would you consider being the least satisfying about a career as a medical interpreting? Or is there such a thing?
Well, I think the main thing that is affecting us now is that providers don't know yet that they are supposed to, by law, provide trained and qualified interpreters for their limited English proficient patients. So that is something that is affecting some states more than others. There are some states where providers know and they do it and they follow it. They know that they are supposed to provide qualified and trained interpreters, and those states have the jobs available, have the opportunities available. Hospitals are looking for bilingual trained interpreters. Some other states do not know that yet, and they believe that just having a bilingual employee is enough, and that bilingual employee is good enough to work with limited, or they just plainly tell the patients, no, sorry, we don't have interpreters, you have to bring your own, which is not okay. So we need to be familiar with the laws for language access. And if you guys want to be familiar with them, I recommend you guys to Google Title VI of the Civil Rights Act of 1964. And that is what medical offices, providers, hospitals should abide by. They should offer language access to everybody. Otherwise, it could be considered discrimination. So that's a problem that I have seen in some states. So that's kind of like the ugly thing. Another thing is that you guys need to understand that if you are medical interpreters, you will see things that you may not like to see. So if you are not willing to go in and see things that it may be sad, it may not be as pretty, it may be sometimes even kind of gross, you will see them. You will be in front of them. If you're not ready for that, maybe that's not the profession you want to follow. I mentioned how I attended several births and they were beautiful, but they were graphic and you're there, you're part of it. And I have 2 children, but I didn't see myself how they were born. Both of them were C-sections. So I really, I was half out, so when you see it on another person, when you are in your full senses, it's a little bit different.
Like, whoa, exactly. what did I sign on for here? But it's important, as a medical interpreter, you're going to be put in all different medical situations. Exactly. In the emergency room, like where you worked, gunshot victims coming in, that's not pretty either, but you still need interpretation services.
Exactly. Burning, like I used to work at the burn unit at one of the hospitals. One of the hardest things and saddest things that I had to do, and you guys have to understand that sometimes you're going to have to give families news that nobody else wants to give, and it's sad. And but that's why we need to take care of ourselves as well. It's got beautiful moments in which you are going to be so happy because you are part of that recovery process, but there are going to be some times in which you will have to give sad news. And I have been reading so much about my fellow interpreters giving news for this COVID craziness that are sad. And sometimes the interpreter is the only person that these people have next to them because their families are not allowed to be close to them. So you have to just, navigate those types of situations. And sometimes you need to know what your limits are. And if you don't feel that you are capable, I would say, to handle certain situations, you have the right to remove yourself from those situations. One of the stories that I tell my classes a lot is that multiple times I had to decline assignments at the pediatric oncology unit at the hospital, and I would send somebody else because I knew that I was not going to be able to handle that. And I felt that that was not fair for the families or the patients or even the providers at the point. So it happened to me a couple times, once or twice, and then I learned my lesson. And then I said, maybe I'm not the right interpreter for this assignment. And I would find somebody else to cover me. And sometimes I just had to, become strong and be stronger than I felt at the time and do it. But then after that, I knew that I had to take some time to just pull myself together and go back and keep working. But guys, that happens in every single career that you take. Not every day is going to be a happy day. And we need to learn how to navigate those situations professionally. And then we also have to learn how to take care of ourselves afterwards.
Absolutely. It's important advice to know how to understand yourself and how you're going to react in those situations, because you cannot be a medical interpreter with tears rolling down your face, or the inability to do the interpretation because you are overcome with emotions. So you must understand yourself. Good advice. So that being said, what have you found to be the most satisfying about being an interpreter?
Okay, so it's just lovely. It gives you a good feeling. It's helping people, the way that people respond to you, the way that people sometimes cling to you. It's like, thank you so much. And it's just so rewarding. And even the providers come to you and say, oh my goodness, that made it so much easier. I again had the opportunity to work with a lot of different providers. Speech therapy was one of the most rewarding one, because I had to work with the provider beforehand so that we could serve these kids correctly. In the words in English are different than in Spanish, so we had to come up with words in Spanish that would make the child produce the sound that we wanted with the pictures that we had. So it was like teamwork, and it was lovely. And to see the progress these children had, it was just adorable. And when you give good news, it's just good. When you tell a mother that she's pregnant after trying so hard for so long, and finally it's happening, and you see their faces, it's just sweet. I mean, and I know I have talked about deliveries, but that is the sweetest time, when you see that new baby and the mom next to them, and you're part of it. You are telling them, they are understanding what's going on because of you. So it's got a lot more ups and downs, I can tell you that.
Thank you, Liliana. You have been wonderful explaining to students all the ins and outs of being a medical interpreter. So any last words, maybe what's your best piece of advice for students that are interested in having this career?
Okay, so if you do have the skill, if you are already bilingual, research, check into it. It's not a big investment. If you want to get into the medical field, and you want to just look at the areas in which you can go in, and then maybe after you're in, see if they need you, see if your skill is needed. And if it is needed, then talk to them, advocate for yourself. Nobody else is going to talk on your behalf unless you ask for it. So talk about it, and maybe talk to the people that you are working with and say, hey, I have this skill and I think I could be very helpful here. Would you support me? Because this is an investment and it's good for everybody. So just talk, research, see if you have what it's needed. And if it is, just when I first started, I was so nervous. I was thinking, oh my God, am I gonna be able to do this? Am I gonna be able to am I gonna come up with the words? Do I know enough? You will find that you are able to do that and that you can, you know, so believe in yourself, study, work hard, put the effort into it. It's not so long. I mean, you said it beautifully. This is not years and years. So it's why not? I think it's an investment. So look into it. And if that's something that you are considering it, then do it. Go for it.
Great advice and great information. And students, if you're interested in learning more about becoming a medical interpreter, maybe seeing if you have what it takes, you can always feel free to reach out to us. You can see the website that's on my background there, www.gsahec.org. And on our website, you can look through the Access program to find Liliana's information, or you can fill out one of our contact forms on the website and it'll be sent to Liliana, and she'll be happy to reach back out to you and give you all the information that you need.
Definitely. Yes. Thank you, Joan. This was great.
So Liliana, thank you so much. It's been a pleasure having you on board with us today. Thank you for giving us your time and all of this wonderful information.
Anytime. Thank you so much for having me here.